Hey, I'm Josh Mia, and welcome to episode 1 of Authentic Practices, brought to you by Mindset Market. Where we focus on helping therapy practices grow through authentic marketing, authentic, fulfilling marketing. And in today's episode, the first episode, I want to talk to you about how precise you can actually be about your ideal client. We do some work in what's called authentic messaging, which is basically saying the most correct version of what your practice is about to the audience that you can help the most in a way that they can understand the best. And that's the authentic messaging program that we teach therapists. And a common question that we get around the issue of choosing my ideal client, meaning who is that audience I want to reach the most, is how precise can I really be? You're probably thinking, I don't want to limit myself around just one group of people because I really want to help a lot of people. And I've been trained in so many different types of methodologies and practices. And in general, I just like working with different types of people. You might also be thinking to yourself, I don't even know how to reach the type of people that I would do my best work with. How do I specify that? And further, you've never done this type of segmentation, meaning you've never done this type of niche marketing before. So you're thinking to yourself, what does it really mean to figure out who my ideal client is and who exactly I'm trying to reach out to? And in today's episode, I want to talk about how precise you actually can afford to be when it comes to figuring out who your ideal client is. So now, real first, what exactly is an ideal client? And to us, the ideal client is the type of client who is receptive to your authentic message. And again, your authentic message is the most correct expression of what you do to the people you can help the most in a way that they understand best. And the reason why we use that definition is because it's not just about who is best served by your work, but also who do you feel the most commiseration with in terms of the work process. Because if there's one thing that we've seen, it's that the relationship is really important to the actual practice of therapy, right? And so that means you want to have a practice where you have a series of relationships that the practice can maintain. In many cases, as a sole practitioner, that means that you can maintain, right? I mean, how many different relationships can you actively maintain in a positive, fulfilling manner where you're progressing them in a way that you're comfortable, where you don't feel any kind of guilt because you're leaving someone behind, or you're not fully invested in someone's work, or you're not just filled with questions as to, am I really helping this person? We want the maximum momentum for your practice. And that comes from having the most fulfilling work, which isn't just a reference to how much money your practice makes per session, but is really a discussion about holistically a healthy relationship that you have with the types of clients that you can help the most and that you're most able to help and the most fulfilled by in terms of that kind of work. So that's what an ideal client really is from our standpoint. Now, if you're thinking to yourself, exactly how do I define my ideal client? I'm just going to tell you openly that that's kind of a significant process that I'm not going to go into in this video. That you're welcome to keep watching other videos in this series. We'll certainly touch on that, and it's something we do actively in the workshops with our clients. However, what I do want to talk about is simply the challenge that we see therapists arrive with when it comes to even thinking about becoming more precise around defining the ideal client. And the reason why that challenge comes up is because you feel sort of an obligation to not limit yourself, right? If someone needs help, if someone wants your help, you want to be able to offer it. Similarly, you feel that you actually can help a lot of people. And when in a common challenge that arrives then is that your practice is frequently ill-defined. Meaning if someone says, hey, I need help with this exact issue, who can I talk to about that? There's so many therapists out there that your clients really struggle with determining, who is it that is really the right fit for me? And so on the other side, you're thinking to yourself, well, I'm a really good fit for that person. I'm a really good fit for that person and that person and that person. And you end up either personally overextended in your practice where, maybe you just have too many sessions with too many different types of clients and you're not doing your best work. Or 2, your practice is not as defined as it should be. So it's a lot harder for someone to just connect with your practice itself. And the way to actually resolve that challenge is, well, one, you do want to go through a process of selecting your ideal client. And frankly, at a broad level, what that means is you think about the clients you've had the best experiences with, or you think about the work where you've absolutely felt your best. And that's probably in the venue of what your ideal client represents. And you can always add more types of clients and more types of specialties to your practice, but generally you do want to have some degree of focus, again, so that you feel there's consistency to your work, that you're furthering your own skills in a way that is very concrete for you, and that people can identify your practice with a certain type of expertise. But beyond that, when it comes to how precise your actual client selection can be, I want to tell you a couple stories. So there's two different ways you can kind of go about actually niching your practice. One is to sort of think about things therapeutically. So I work with individuals who struggle with anxiety and depression. That's a very specific statement. I work with individuals. That's a classification, meaning I don't work with groups. I don't work with couples. I don't work with families. I work with individuals. That's a way to classify yourself to some extent. Also, by specifying anxiety and depression, you're also saying that we're not necessarily talking about issues related to, let's say, only something related to sexuality or only something related to relationship counseling. But you're really honing in on that topic of anxiety and depression. So a heaviness in your chest, the inability to sleep because you're too anxious at night, or that you have a certain type of feeling around your motivation during the day. Right? These are things typically associated with anxiety and depression. And so therapeutically, you can say, I work with individuals who struggle with anxiety and depression, and that really does help you more or less achieve some type of definition for your practice. And that really helps people find you, to be honest, right? So that's one way to niche yourself, is therapeutically. The second is to just be hyper-specific around your audience. I mean hyper-specific around your audience. And so what that means is, for example, so there's a therapist that I know of who specializes in working with stepmoms. And that's a very, very specific classification. So she herself, entered into a relationship, she became a stepmother, and through that process, she experienced a lot of personal growth, a lot of fulfillment, and she decided that I want to help women who are very much in that same category. And so she chose to work with stepmoms. And so what does that mean? Well, it means that she works with stepmoms. It means that she can speak to other women who have that same type of problem. It means she's open to couples or family therapy where the issue is related somehow to parenting or motherhood or stepmotherhood or that type of issue. She could even speak at certain conferences or events on that exact type of issue as a specialist who knows so much about that topic. She can write about that subject. She can be really well known for that subject. And so she's kind of dominating that exact subject, right? And so whether it's individuals, couples, or family therapy, she really knows that subject. Another example that I really like is a therapist who specializes in what she calls compassion fatigue. And so she works with animal control specialists, or ultimately did, on the basis of them having to too frequently be involved in euthanasia, right? A very terrible, tragic, sad thing that is somewhat unique to the experience of people involved in animal control. And she previously worked in animal control. So again, you take this personal experience you have, you find a challenge, and you grow through that challenge, and it turns out that your training as a therapist gives you a special angle on that issue, and then you build your reputation around that. And the reason why I like these two examples, either specializing in mode or specializing in sort of a topic. And I realize the mode is kind of including topic, right? Individuals, anxiety, depression, but we are still not saying couples. We're also not saying families. So we have some degree of definition. But when you do one or the other, it really helps you achieve some degree of definition and makes you more comfortable with your practice because you really know it's something that you have a lot of competency in because you're doing it all the time. That means if you raised your rates because you wanted to, you'd probably feel more justified in doing so because you know exactly how much value you deliver because you see it all the time. You've turned your therapy service into something that's highly predictable to some extent. Sort of like if you were to go see your healthcare provider in terms of your family doctor or something like that, they see strep throat all the time. They don't treat everybody who sees strep throat differently, right? There's a certain process where you arrive at, this person seems to have the symptoms of strep throat. We've gone through the test. This is how I help that person. And the cost for that service is relatively stabilized. You can achieve a similar type of consequence in your therapy practice, and that also allows you to formalize your service a little bit. So you can say, I have a 90-day plan to help you achieve comfort, with your anxiety. First we do step 1, then we do step 2, then we do step 3. And the reason you can say that is because you've practiced it so many times. If you don't have that kind of definition to your practice and people are coming to your practice with a huge diversity of different types of issues, it's harder for you to express that you have such a clear plan for all those different types of trauma, all the different types of challenges. So that's what it means to achieve some degree of precision when you're choosing your niche. It's that you're saying to yourself, I'm a real topic specialist, or I, to some degree, am a mode specialist. I work with individuals or couples or families or groups, and to some degree, I'm saying I do a lot with anxiety, depression, or, you might say, for example, I work with individuals who suffer from trauma and PTSD, or, you can, to some extent, that you eventually you arrive at topic expertise, right? It's not uncommon for someone to say, I work with individuals who struggle with anxiety and depression. And then eventually that turns into something they can personally relate to, where I work with individuals who struggle in their relationships as a cause of a lot of what they struggle with, right? So I'm a relationship counselor who works with individuals who struggle with anxiety and depression. Now I'm more of a topic specialist. Maybe I went through a divorce myself. I learned through that experience. This became a way that I counsel people through my experience, as well as kind of sharing in that. So one type of niching can easily lead to the other, but a topic specialty is a perfectly legitimate way to go. And the reason why I want to mention that is because if you think to yourself, hey, there's something I'm really, really passionate about, that I just think about all the time and that I know I'm really terrific at, and I just want to contribute to people's lives on that front all the time, that it is a valid way to create your practice. It's a valid way to live your life. It's a valid way to help people. It's a valid way for you to charge for your services and to grow a terrific, fulfilling practice that is financially successful, is therapeutically wonderful, and ultimately makes you very happy and helps your clients go where they want to go. So that's what I really want people to think about when it comes to how precise can you really niche your practice. So one caveat that I want to add is that when I talk to a lot of therapists, I kind of get this as a very typical response and concern about niching their practice is, can I really say with any degree of assurance it's going to take 90 days to achieve a certain outcome, or 120 days, or what have you? And I just want to be 100% clear. Just because you're niching your practice doesn't mean you're limiting your therapeutic process. What you are doing, however, is you're being able to provide some degree of definition of, let's say, even the stages that someone is likely to go through, even through the process of therapy. Now, some therapists will openly say, I have a 90-day process to achieving such and such, and then they'll also say, for some people, it takes a little bit longer or a little bit shorter or what have you. But at the very least, you probably have some type of process you see people go through. Maybe they go through a learning stage where they interact with you and they learn more about themselves and their experiences. Then perhaps they go through a practicing stage where they sort of take what they've learned in session with you, and they apply it to their own lives. And then perhaps they go through an integration stage where now that they've practiced these things, they're applying it to their lives, they're becoming comfortable with who they are. It would be pretty usual for you to say that, yes, people do go through a certain set of stages. And they may be very different stages than what I've described. I'm talking about these stages from the type of conversations that I have with other practitioners. You may describe yours very, very differently, and that's okay. But the overall point is that there is a process that people are going through. It may sometimes lack a significant amount of definition in terms of time frame and exactly how they're going to feel at the end. But the important thing is that the more specific you are when it comes to niching your practice, the more specific you can be about the type of experience someone is likely to have over the course of therapy. And that increases the buy-in to therapy that someone has at their very first session. A common issue that I hear therapists discuss with me is, I'm seeing clients, but it's only once. When I see too many clients, they come in, we're not a great fit, or for whatever reason, I only see them once and they don't come in again. Well, a lot of that has to do with a bad phone call when someone was first contacting you about their issue. And the reason it's a bad phone call is because you may not have given them the type of description that they really needed to achieve more buy-in to the process. And you had every intention of doing so, but because you haven't niched your practice, you don't have the descriptive language that directly goes to the client's self-talk, right? How they're thinking about their own issue, so that when they first arrive at the session, they have pretty clear expectations. They know this isn't going to be a one-shot deal, but they also know that you're just trying to see if you're a good fit. But if things take longer, they are receptive to it because they know what the therapy is meant to actually conclude with. And that is, they're going to be a better version of themselves, a more successful version of what they're trying to achieve. To some degree, they'll find resolution and they can see it in their head a little bit, and that increases the buy-in to the actual first session, and that means you're more likely to see them for session 2 and 3 and 4, or however long it takes for them to get the results that they're looking for. So even though you're not going to, say explicitly, and in some cases you might, and that's okay, because I've certainly seen it, where you want to say I have a 90-day plan, and you stick to that 90 days, maybe there's a couple extra weeks or what have you. But, at the very least, when you niche your practice, that helps you arrive at more descriptive language for the experience someone's going to have throughout therapy. It helps you have more productive conversations with people, and it helps you literally increase the successful outcomes of your practice, because people have a better idea of what they're getting into before they even begin. And that's just a way to have a more fulfilling practice. So don't worry about therapeutically limiting yourself. Think more about expressing, again, the correct message of your practice to the audience that you can help the most in a way that they can understand the best. That's what we call the authentic message. Okay, now I know I've given you a lot to think about, because now you're going to niche your practice and you have an idea as to who you help and how you can help them the most and all that kind of stuff. But you probably have some questions, and I want to encourage you to leave questions right down below. Comment on this video, ask things. I'll reply to as many as I can. You can also email me at josh@mindsetmarket. I never forget for a single second why you do what you do. It's the exact same reason that I do what I do. You got into therapy to help people be more successful in their lives, to achieve their dreams. And you feel like that you're someone who can really help them do that. And I do what I do because I love working with therapists, because I know they can make a difference. So whatever questions you have, get in touch, ask a question, like this video, subscribe to this channel, and I can't wait to hear your questions. Again, this is Josh with Mindset Market, and this is episode 1 of Authentic Practices.